I cannot think of a better way for those of us who are members of Alpha Kappa Alpha Sorority Incorporated to begin the celebration of our Founders Day than to be here and providing you all with access to this exceptional panel of experts. So thank you again for joining us, and I'm anxious to get to it. Thank you.
And from our partnering organization, the Greater Queens chapter of the Links Incorporated, President Paula Brown Egme.
Good evening, everyone. It is indeed an honor for Greater Queens chapter of the Links Incorporated to participate and co-partner with our partners, Epsilon Pi Omega chapter of Alpha Kappa Alpha Sorority Incorporated, on a Zoom program that is so vitally important to our community. All of the facts and information about COVID-19, how it has impacted our community, information about the vaccines that are available to us, their medical effect, and how we, if we choose, can get the vaccine that is so important to our health and survival beyond this pandemic. I wish to extend heartfelt appreciation to the medical experts who put their lives in danger each and every day, administering their medical expertise, saving our lives, and sharing their knowledge this evening. I will be listening, as I know you will be, taking note of the information they will share with us tonight.
And our participating organization, Jack and Jill Incorporated Queens Chapter President, Greer Hansen Velasquez.
Good evening. Thank you so much. On behalf of Jack and Jill of America Queens Chapter, I wholeheartedly thank, actually technically my home chapter of Alpha Kappa Alpha Sorority Epsilon Pi Omega Chapter. Thank you all for this opportunity, this timely discussion, the dynamic panel, and the opportunity to include our youth as part of this, which I think is a very key piece. So we are anxious to hear the information. We thank you for the opportunity. And as Sora Stephanie said, ready to get to it.
Good evening. My name is Sharon Scott Brooking, and I am the co-chair of the Connection Committee. And it is my pleasure this evening to introduce our moderator for the evening, Dr. Lornette Wolford. Dr. Wolford has served in various roles in the clinical setting in medicine, surgery, and critical care, as well as in the academic setting as a professor at several schools of nursing. Currently, Dr. Lornette is Vice President for Nursing Education and Professional Development at Northwell Health and Assistant Professor at the Hofstra Northwell School of Medicine. She continues to be an integral member of Northwell Health's COVID-19 strategy and response leadership. So it pleases me to introduce our moderator, Dr. Lornette Wolford.
Thank you. Thank you so much for that warm introduction. It really is an honor to be here among friends tonight to have this very important conversation, and a conversation it will be. We have an esteemed panel who you will learn more about as the evening progresses. They include the Honorable Donovan Richards, Borough President of Queens, Dr. Michelle Reed, a board-certified family medicine physician, Dr. Bonita Co, an internal medicine physician, Dr. Esteem Barnes, patient care director of critical care, and Dr. Francois Dufresne, also a medical internist, and Jacqueline Hunter, who is a registered nurse who leads a podcast called Not Just a Nurse. So we have a variety of perspectives to inform the discussion we will have tonight. At this time, I would like to hand it over for a few minutes to Dr. Alex Dufresne to introduce the teens who are with us tonight.
Good evening. Okay, if I can ask my Jack and Jill teens to turn on their cameras. Alrighty. I'm pleased to introduce 4 brilliant young leaders who serve the Queens community through their membership of Jack and Jill Queens chapter. First, I'd like to introduce Ms. Brianna Robinson.
Hi, my name is Brianna Robinson. I'm a 9th grader at Archbishop Malloy High School and a member of Jack and Jill Queens, New York. My question is,
You
will
don't
kids my...
have to ask your question yet, hon. Just introduce.
Oh, sorry, that's my name. Nice to meet you.
Welcome, right. Thank you. Miss Isema Castle.
Hello everyone, my name is Isema Castle. I am a sophomore at Marymount School of New York, and I am the Teen Presentation Chair of the Jack and Jill America Queens chapter.
Thank you, Isema. And now Mr. Wesley Ramsey, the 4th.
Good evening, everyone. My name is Wesley Ramsey Jr., or the 4th. I'm a senior at St. Francis Prep, and I'm a member of the Queens Jack and Jill chapter as the vice president. Thank you.
Thank you. And last and certainly not least, Mr. Jabari Duncan.
Good evening, everyone. My name is Jabari Duncan. I'm a senior at Columbia Secondary High School, and I'm the team president for the Cosmos Group, and I'm a member of the Jack and Jill Queens chapter.
Thank you so much.
Thank you so much. I just wanted to share the good company that I'm in. Tonight, I will be moderating, but later in the discussion, our youth will be discussing important questions with our panelists as well. I'd like to start off with a brief video presentation to provide some fundamental information about the vaccine and just to level set before we get into the dialogue with our panelists. Can we go to the video? Perhaps while our video is loading, we can take a few minutes to hear from some of our panelists a bit about their background so we know a little more about you. Can we start with Dr. Bonita Co?
Yes. Good evening, everyone. I am Bonita Co. I'm an internal medicine physician. I'm currently practicing outpatient medicine at Johns Hopkins Community Physicians. I did my undergraduate training in human biology at Stanford University and went to medical school at Howard University College of Medicine, and then did my medical training at the Cleveland Clinic. And I'm happy to be here.
It is a pleasure to have you. Thank you so much. Dr. Barnes?
Good evening, everyone. My name is Esty Lightson Barnes. I am a doctoral prepared nurse. I've been in nursing for 18 years. I am a critical care nurse. I've always been in critical care. I've been on the front lines of COVID. I've worked with COVID patients. I am currently a patient care director, and I lead the team at New York Presbyterian Lower Manhattan Hospital during the COVID pandemic.
Wonderful. We can't wait to hear from you. Thank you so much for being with us tonight. Dr. Dufresne?
Yeah, hi. I'm originally from New York, went to high school in Queens and did my undergrad here in the city. And then I went down to Morehouse School of Medicine to get my medical degree. After leaving Morehouse, I came back up to New York and did my residency in internal medicine at NYU. And since then, I've been here in the city working initially in the hospital as a hospital-based physician, and now over the last few years working in primary care in the city as well.
Wonderful. Thank you so much for being with us.
Of course.
Ms. Hunter?
Hi, I'm Jacqueline Hunter. I received my undergraduates in nursing from the College of New Rochelle. I went to Stony Brook, then transferred there. where I graduated with a BSN in nursing. I later on went on to get a master's in public health. I've been in nursing for over 25 years. And I currently work as a nurse manager at Forest Hill, Northwell Hospital. And I've had a lot of experience with quality and also worked for Jacoby as an assistant director of nursing there. So currently we are fighting the COVID battle at Forest Hills, and I'm so happy to be here. I think it's very important that we let the public know like that it's really important for our communities more so to get on board with the vaccination to end this pandemic. And I just launched a new podcast called Not Just a Nurse to just highlight nurses all over the world and show that we're just so much more and we do so much for the community.
Indeed, indeed. Thank you for being with us tonight. Dr. Reed?
Good evening, everyone. I am very excited to be here. I guess I bring a different perspective because I've been in private practice for about 20 years so far. And I guess my perspective is I'm in the community that I grew up in. I never really left Long Island for school. I love to travel though, but all of my education has basically been based on Long Island. That's from high school, elementary school, really all the way to medical school and residency. So it's indeed an honor and privilege to be here because back in March, the end of March, I actually had COVID, and my story has gone international because one of the things that God kept saying to me is that he wanted me to share my story. And that is what I did and I continue to do. I do have 2 locations of my practices. One is in Rosedale, Queens, which is right there in Southeast Queens, which was the epicenter for Queens. And the other one is in Garden City, which was right next to the epicenter of Long Island, Nassau County, Hempstead. So I am excited to share. I really want people to be open and to ask questions because I see it, I've experienced it. Really, I'm experiencing it again in my household. So it's very important that if you have questions, you can talk to us, but at the same time, you can also talk to your medical provider. And it's important that you really ask because right now, by us not asking the questions and relying on past events is affecting our health. And that is one of the things that Fit Doc Michelle Reed is very concerned with.
Thank you, Dr. Reed. And lastly, I'd like to introduce the Honorable Donovan Richards, Borough President of Queens.
Thank you so much, and what an honor to be here. And I want to thank all of you for hosting such an important event. I was with the mayor actually on Monday, and we were at Hillcrest High School where some of the first vaccinations were happening for those 75 years and older at that time, but now 65 years and older. And even being there on Monday, we recognize that there are a lot of disparities around the vaccine already and who's getting vaccinated. So there's a lot of work to be done. You know, I'm proud to represent all 2.2 million people of Queens County and look forward to the dialogue and work ahead to make sure that our communities, especially the communities that were hit hardest by this pandemic, which are ours, Black and Brown communities, are getting their just due, and that we're pushing government, including the mayor and the governor, to make sure that vaccinations are centered in the communities that were hit the hardest. So I want to thank you all for having me this evening.
Thank you all very much. And, you know, you started to actually provide the perfect segue to some of the things we want to talk about. So if you don't mind, I'd like to start with a dialogue with you tonight, Mr. Richards. We'll get to the video a little later in the conversation.
Thank you.
Can you tell us a little bit and tell the community a little bit about how the spread of COVID is affecting the Queens community? Is Queens doing better, worse? Give us a frame of reference.
Well, right now, Richmond Hill is and South Ozone. These are communities, the Indo-Caribbean community. And I actually was speaking to the Washington Post today, who's actually writing on this specific issue, is leading Queens right now. So you sort of look at the areas where we're seeing the rise in positive cases. And a lot of times those are immigrant communities. There are communities that are sorely disconnected from city government, communities where we don't have language access, or where the city has not been culturally competent in the materials that they provide to these communities. So we saw it there. But throughout this pandemic, without a doubt, when you look around Queens, Far Rockaway was hit hard, Southeast Queens, and you look up into Jackson Heights and Corona, you know, these are areas that primarily are comprised of people of color. And we got a lot of work to do to make sure that the disparities that existed, see, all COVID did was lift the sheet off of all of the disparities that we knew have existed. When you look at where hospitals are, right? And I've done, over the course of the last few weeks, I've toured about 6 hospitals. There are 9 total hospitals in Queens. But think about how many hospitals we lost, from Mary Immaculate to Peninsula Hospital out in the Rockaways. So where you're seeing this influx of COVID cases, it's really communities that were impacted and negatively impacted by these these hospital closures, where there's a lack of healthy food access, where there are a lot of underlying conditions, where there's poverty, where people are spending more than 50% of their paycheck on rent. And, you know, I talking to the Washington Post today, you know, it's very apparent there's a common denominator when you look at all of these communities, and it's about who can stay home and who has to go to work. There are many of us who don't have the luxury of staying home because we got to try to pay that rent and put food on the table, opposed to taking care of our own health. So we're subjected to actually catching COVID more likely than other communities.
So true. And, you know, you started to talk about the makeup of the Queens community, immigrant community primarily. So, and language and other factors that affect communication. So can you tell our Queens community and our Queens residents, how does one get the information that we need about COVID, about the spread, about the vaccine, which I'm going to ask you about in a few minutes? Where do our Queens residents turn for the facts?
Well, well, one, you know, you can always turn to my office. One, 2, you know, one of the things, and I just was on with the mayor's civic engagement office a little while ago, just speaking about how we get this information out into communities. And one of the challenges we've had, and this is why I'm very happy to be part of this forum, is that information is not disseminating to community-based organizations like all of yours. And we really need this to be a team effort where the city comes in and they're really working with community-based organizations, which we've seen not happening across the borough, which has certainly presented its challenges when it comes to testing, when it comes to the vaccine. Once again, talking about the disparities we're already seeing in who's getting vaccinated. There's been a huge hesitancy, even within hospitals, amongst people of color getting the vaccine. I was at Mount Sinai. I was actually at Forest Hills LIJ just a few days ago, and they were pointing out, just yesterday actually, and they were pointing out that many workers of color, are not taking this vaccine. So we know we have a sordid history with vaccinations in this country and the trust with it. And it's going to take all of us rolling up our sleeves in forums like this, quite frankly, to make sure that we're disseminating the right information into communities of color. But I can't say that the city's done a great job with this. It's a conversation I had with the mayor just on a few days ago, and just tonight with the Office of Civic Engagement.
Yes, the medical mistrust is a very true issue in our communities, Black and Brown communities. It's historic, and it's interesting that a lot of the time it seems that the dialogue around the mistrust that exists can be perceived as unsympathetic, you know, or not acknowledging the experience that people of color have had factually when it comes to medicine. So understanding that here we are amidst the spread of a deadly virus, amidst a global pandemic, with medical mistrust prevailing in our communities, what advice would you give to members of the community about vaccination, understanding what they might be thinking?
That it's safe. And you know, I visited, like I said, at least 6 hospitals. And I have not got the vaccine, but I can tell you when I'm eligible, I will be on one of those individuals on the front lines. Just this week, you might have heard that the Met Stadium is going to be one of the central places that you can get vaccinated 24 hours, 7 days a week. But one of the things we're pushing for is to make sure that there are more institutions in our communities that are open 24 hours, 7 days a week. We should be using, you know, our faith-based houses of worship. We should be working with local organizations such as yours. You know, if I'm doing a civic association meeting or having a town hall, God willing, when we can all get back to some semblance of normalcy, we should be offering the vaccine right at those locations so that people can take them safely. We know that also right now, the federal government, at least under this Trump administration, that the dosages are not reaching the states at the level that they should. We also know that there's been a lot of politics between the state and the city. So we're trying to break through all of these things. But the most important thing I can say to everyone on this line tonight is that the vaccination is safe, and that, you know, for every hospital, every institution I visited where people have been vaccinated, I've witnessed the vaccination. I actually was at Elmhurst Hospital. I witnessed one of the first workers in the Health and Hospitals Corporation Network, who was a Black man from South Jamaica, get the vaccine. He's worked at Elmhurst for over 30 years. He felt good outside of the muscle soreness. So you're gonna be okay. And also I'll just add at Hillcrest, we witnessed, Danique Miller and I were there with the mayor this week. We witnessed a 97-year-old young lady from Rochdale Village getting that vaccination. She was in the holding room after she got the vaccination. She felt good. She felt like, you know, it was a sigh of relief for her. I then proceeded to go down to the police headquarters where they do their training down in Queens as well. We witnessed our police officers getting the vaccination. So you're gonna be fine. Take it so we can get back to some semblance of normalcy.
Thank you for that very clear and concise response. Can you tell us more about the costs, if any? You know, these are the kinds of questions that members of the community have. Will I have to pay for this vaccine? Do I need insurance? What if I am here illegally? Can you tell us a bit more about access to the vaccine?
No, the government is paying for it. I was on today, actually, the mayor just added 200 million. So we have a proposed budget that the mayor just proposed today, where he's adding $200 million to the Health and Hospitals Corporation to deal with testing and the vaccine. So no, there's no questions asked. No questions asked on your, and it's very similar to when you go and get tested. And actually, we've passed laws around that in the city, at least in my prior life in the city council. I think Adrian Adams is watching tonight. So on the city, you know, anything related to the city, you're fine. We don't ask those questions. So just as if you wanted to go get tested and you're undocumented, it's free of charge, no questions asked. No one needs to know whether you're documented or undocumented. The vaccine is free of charge. You'll have to make an appointment. So if you're 65 years and older, you can make that appointment. One of the things the mayor had a critique on actually is when you go to get tested, they should set, because remember, you have to get 2 doses and you have to get that within 28 days. One of the particular treatments is 21, but on average it's 28 days. So after you get your first dose, and within 28 days, you need to get your second dose. And you should be able to set that appointment right then and there while you're getting your first dose. But you know, that was something we recognized that was not as airtight on I believe Tuesday or Wednesday, and the mayor directed the health commissioner who was there with us to make sure that when you're on that line and you get the first dose, that you can set your second appointment. So no questions asked, free of charge. We're paying for it. Go get it.
All right, I love it. Do you have an idea? You know, you mentioned that we were off to a bumpy start with this communication around community vaccination in general across the state, leading people to feel confused and perhaps misinformed about when they would be able to get the vaccine, who the priority groups are. So do you have an idea about the timeline for Queens, and can you share some of that?
Well, for the city, period, we're anticipating, and this is per the mayor and I were having this discussion, and we're actually pushing him to open up more sites in Southeast Queens, especially perhaps Andrew Jackson. Aqueduct Racetrack will actually open up. The governor is going to open that up as a vaccination site within a few days. We also are pushing on public housing. So on tomorrow, I'll be down at International Houses, which is in Jamaica, to witness our senior citizens getting the vaccination right where they live. We anticipate in March that the general public, so all of us, will be eligible to start getting the vaccine. So the big push right now is to make sure that you don't have to travel 10 miles to get to get your vaccination, and to make sure that the process is clear and concise and streamlined. So as you make your appointment online, because one of the things we heard is that the website crashed. Not everybody has internet. You know, you may need to call in. So we want to make sure that those things are happening in a real strategic way, so that as you call in and book your appointment, the website is not crashing, or you're not getting somebody who picks up the phone. And I know the city council had a hearing on this yesterday, led by the chairman of the health committee, Mark Levine. So, but I do want to just point back to, you know, just as we were at Hillcrest, that there was a lot of good feedback. There was so much good feedback from people who went online, they booked, including the 97-year-old young lady from Rochdale Village who booked her appointment, and it was seamless. If you're elderly, one of the things we're pushing for, especially if you're disabled or over a certain age, that when you get on that line for an appointment, you don't have to stand it. You should be ushered right in. So, so I think things are moving in the right direction. And I anticipate March, the mayor said, but if the mayor says March, then think April, May, you know, everybody should get vaccinated. They'll be able to get vaccinated. Also, let me add that the 65-year-olds, I believe, also include this new phase, also includes those who may have underlying conditions. So that's beyond your age. You know, if you have an underlying condition, you'll be vaccinated as well.
Thank you so much for clarifying that. I am aware that you have another commitment, and so I'm being mindful of your time, but I would like to really ask you to share, you know, any advice, you know, take a little time to talk to our viewers today, to share your words of wisdom before you have to go on to your other meeting, about what you want everyone on the line here to know tonight.
So there are three simple things. One, let's be responsible. Let's remember that there are people who died, frontline workers, like a good friend of mine's, Priscilla Carroll, who worked at Elmhurst Hospital, who was in the hospital at the height of the pandemic, trying to take care of everyone who passed away. You know, I'm reminded of noble men like Jules Taylor out of Rosedale, who was such a special young man, you know, who died at a young age of COVID. We're going to rename a street for him this week. So let's take some personal responsibility and wear our mask and social distance and avoid crowding and groups as much as possible until we're out of the woods. The more pain we take up front, the more sunlight at the end. So let's just start there. The second thing I want to say is that many of us fought for testing for our communities. Remember, early on, there was very little testing being given to South Queens, to the Rockaways. And, you know, there was elected officials from South Queens who pulled our resources together, led by Congressman Gregory Meeks. I mean, we took money out of our own pockets at that time because we could not get testing sites from both the governor and the mayor at that time. And then we fought hard and we won. You know, we finally got some testing sites. So I urge everybody to get tested. It's a simple swab. And by getting tested, you know, most people will say they don't have symptoms. You could be asymptomatic. So that just because you don't feel any symptoms doesn't mean you're not walking around spreading the virus. So I would urge everybody to get tested. I just got tested again this week. By God's grace, came back negative because as an elected official, you're definitely subjected more to being around people than most individuals, although I limit as much interactions as possible. So take advantage of the testing. It's free. It's an easy swab up your nose. If you go to Health and Hospitals Corporation facilities, no questions asked. They have an app. You'll get your results in a timely fashion. I can attest to that. They're very professional. So take advantage of that. The third thing I'll say is take the vaccine. Let's not play games. Let's not be cute. Let's take the vaccine. I know we have a history, but if I'm telling you that there's been very little impact to people who've taken it. I think there was one individual out of all the 6 hospitals I visited thus far who had a reaction, and they actually had allergies attached to it, who had a history of allergies. So they had a negative reaction, but still lived through it. You know, that was one thing we saw, but that's the only case I've heard out of all of the hospitals who've administered this vaccine to thousands of their workers. So really take advantage of it. And I think by getting the vaccine, if everybody's disciplined, and you know, I'm being conservative, by early next year, we're back to some semblance of normalcy if we all do our part.
Thank you so very much. Your segment was just perfect to get us started and so very informative. I just have to say thank you so much. You know,
Thank you so much, and thank you for doing this. And anybody watching who has an organization, you know, I'm willing to come on. We should all do this as consistently as possible until we move through this pandemic. The more information we can spread amongst Black and Brown communities, Black and Brown-led organizations doing this sort of stuff, the better it is for each and every one of us.
Yes. Agreed. Thank you so very much. So at this time, yes, at this time, I'd like to see if the presentation is ready. And if so, we can go to the video. Okay. Well, we are going to just be agile and we're going to move on through some of the questions, and perhaps the team can let me know when we will be ready to show the video. So at this time, I'd like to move to some of our other panelists and start to ask some very important questions, starting really with just the basics about the virus, about the vaccine and your feedback on that. So I'll start with our physician panelists first. This question is directed toward you. Can you tell us about whether the vaccine is airborne? These are questions that folks have brought to us. Airborne, meaning that it's lingering and floating around in the air and I need to wear a mask at all times, or whether this is more of a droplet spread where it needs to, I need to come in contact in a very close fashion, 6 feet or less, with someone who has it. Would someone like to tell us about how the virus spreads, please?
Hi, I can answer that. The answer to that question is both. It's droplets and airborne. And so that's why whenever you're out of your house, you need to put on a mask. I tell people as soon as you come back into your house, the first thing that you should do is wash your hands. One big way that people are infecting themselves is by not washing their hands and then touching their eyes, their nose, and their nose and their face. So it is airborne. So just because you go into a room and it's empty, if somebody was in the room before you and was infected, you can still be infected from that person, even though they have left the area.
Thank you for getting us started with some of those facts. I think you're going to walk us through the presentation at this point, right? To help probably answer some of the questions that I have lined up. That might be answered as you go through the slide presentation, right, Dr. Co and Dr. Barnes?
Yes. Good evening, everyone. we're very happy to be here today to go over the COVID-19 vaccine and our community. Next slide, please. So I am Estine Latson-Barnes. I am a member of the North Atlantic Regional Medical Response Team. I'm also a Belay member, and I live in Brooklyn, New York.
And I am Bonita Co. I am an internal medicine physician. I'm also part of the North Atlantic Region Medical Response Team. And I am a life member of Alpha Kappa Alpha sorority in Xi Zeta Omega chapter in Washington, DC. I'm also a leadership fellow coach, primarily coaching sorors who are interested in becoming physicians. Next slide.
So I would like to start off with our disclaimer. So please be aware that any information given is not intended to replace the recommendations made by your healthcare providers. Please consult your own medical professionals before initiating any dietary changes, physical activity, medications, or treatments. Next slide, please. So one of the questions that's come up is, how does the COVID-19 vaccine work? So what the COVID-19 vaccine does, it helps the body to develop immunity to the virus that causes COVID-19 without actually getting the virus. So what the vaccine does is that it allows the body's white blood cells to learn and how to fight, and they make them remember how to fight the virus in the future. So the vaccine is what we call a messenger RNA vaccine, and that's what you may be hearing a lot, the mRNA vaccine. So the first COVID-19 vaccines authorized for use in the United States are these mRNA vaccines. And just so everyone knows, these mRNA vaccines, they undergo the same rigorous and effectiveness standards that any other vaccine in the United States goes through before it's used in the public. Next slide, please. So we're going to talk a little bit about actually how the vaccine works. So I said earlier that what it does, it helps the body to learn how to fight the vaccine. So to fight the virus. So what the mRNA vaccine does, it makes an antibody to the virus, and the antibody is what we call a spike protein. If you go to the next slide, I can explain a little bit more what that means. So what happens is that the mRNA vaccine, it teaches the body to make a harmless piece of protein called the spike protein. And this is the same spike protein that is found on the surface of the virus that causes COVID-19. This spike protein, what it does is that it triggers an immune response within our bodies. And this triggered immune response is what actually produces the antibodies. Now, after the body has produced these antibodies, which protects a person from getting the actual infection, these antibodies, that the mRNA antibodies, they then are removed from the body. You can go to the next slide. Thank you. So some of the things you need to know, because this comes up so much. Will I get COVID from taking the mRNA vaccine? No, you will not. The vaccine does not cause COVID because we do not use the live virus in the vaccine. And also, you hear a lot of people say, well, this vaccine is going to get into my DNA, it's going to mess up how my body is made. The way that the mRNA vaccine works, it never even enters the nucleus of the cell, which is where our DNA is located. And like I said earlier, the immune cells in our body will break down and get rid of the mRNA right soon after the antibodies have been produced. Next slide, please. So what are some of the vaccines that we have? So there's two types of vaccines that are currently approved for use in the United States, and they both have more than a 90% effectiveness of preventing the COVID-19 vaccine. So there's two. There's the Pfizer BioNTech vaccine, and that requires 2 shots 21 days apart. And then there's the Moderna, which also requires 2 shots 28 days apart. One of the differences between the two vaccines is the storage for the vaccine. So in the hospital setting where we have the type of refrigeration that can hold the very cold temperatures that the Pfizer vaccine uses. So a lot of the hospitals have the Pfizer vaccine. The Moderna vaccine, which doesn't require the same level of refrigeration, the same temperatures, is what you're going to find more in the general public. And also, one of the good things about the Moderna vaccine as well is that it can be taken to some more of the rural areas and harder areas where it is to get the Pfizer vaccine. I myself, I am fully vaccinated. I received the Pfizer vaccine. It was available here in New York on December 15th. I took my first shot on December 16th, and I took my second shot on January 6th. And I'm happy to report, just like the Honorable Borough President had said earlier, my only side effect was a little bit of not swelling, but pain in the injection site. I had no other side effects to the vaccine. But some of the other side effects that some people have reported have been the pain and the swelling in the injection site, low-grade fevers, some chills, tiredness, and headaches. But these side effects, they usually subside within 2 to 3 days after receiving the vaccine. Next slide, please.
So the North Atlantic Region Medical Response Team was also asked to talk to you about why you should get the vaccine, but we think the more important question is why you do not want to get COVID-19 infection. Just like many other viruses, there is no cure for this infection, and we only have experimental treatments for the infection if you get sick enough where you need one of those treatments. And experimental means at this point, we don't know if they work or not. The other issue is that COVID-19 is just not a few days or a few weeks of infection and symptoms, and then you're done with it. A lot of people are having long-term symptoms, weeks and months at this point of lingering symptoms. And at this point, we do not know the full spectrum of the long-term complications of this infection. So getting the infection doesn't mean it's going to be done in a few weeks. And we don't know what can happen in the long term. When you get COVID-19 infection, you must isolate yourself at home if you're able to stay home for at least 14 days so you don't infect others. Next slide, please. The other reason why you don't want to get this infection is that a lot of people are getting sick enough where they have to be hospitalized and be in the ICU for prolonged periods of time. And it is not fun being in the hospital, being isolated from your friends and family. You can't have visitors. And this infection is really bad if you end up having to be in the hospital. People are having problems with blood clots and severe pneumonias. And the main issue that people are having with the infection when they have to get hospitalized is trouble breathing. And if you've ever had a problem with breathing, it is not fun. Even when people get out of the hospital, they're still having complications and prolonged illness. And obviously we know how many people have already died from this infection. The people that have long-term complications, actually, we now have a name for them. It's called long haulers. And lots of different clinics are opening up all over the country to take care of these people who have long-term infections. And we really don't know what to do with these complications. It's just about watching to see what happens with them. Next slide, please. I already talked about prolonged breathing problems and other symptoms can last for weeks and months. And a big reason why you do not want to get this infection is because you may not be severely affected by it, but you can infect your family members who you live with, and they may be the ones who get severe illness from the infection. A lot of us have underlying chronic conditions that may or may not be controlled. Your blood pressure is not controlled. You're not taking your blood pressure medicine. You're not checking your glucose if you have diabetes. Having underlying conditions, including obesity, whether they're controlled or not, can lead to more problems if you get COVID-19 infection. That also includes if you have rheumatoid arthritis, HIV, any other disease that affects the immune system. And that also includes medications that you may be taking that affect the immune system, like prednisone. Next slide, please. So for those people who are considering waiting this out and seeing what happens, I caution you about doing that, because as more time goes on, you will be less and less able to hide from COVID-19 infection. When I was putting together this presentation from the CDC website, as of January 4th, 2021, 2 people in this country are dying per minute from COVID-19 infection. Viruses are small, you can't see them, you think it's not out here, but COVID-19 is widely present in whatever community you're living in. And the biggest issue is people who are contagious and infected, but they're not symptomatic. This virus is, like I call it, like a burglar. I got that from somebody else, but for today's purposes, I think it's just like a burglar that is just waiting to invade and evade your immune system. As time goes on, you cannot be perfect in protecting yourself from this virus. The one time you forget to wash your hands, or you put your hands in your face, or you don't have your mask on, this virus is waiting to sneak into your mouth, your nose, and get into your nasal passages like a burglar and come in and take over your immune system. Next slide. What I'm seeing in my own practice is whole families being affected and wiped out by this infection. So if getting the vaccine is not just for yourself, it's also for your family. Next slide. People have concerns about how quickly the vaccine was made. While these 2 mRNA vaccines are new vaccines, but the actual technology about mRNA vaccines has been out at least 10, 15, and I actually saw a lecture today, at least 20 years. And remember, your tax dollars are paying for the development of this vaccine. Our federal government came up with the Operation Warp Speed program, and they facilitated paying for the development of the vaccines with Pfizer and Moderna in large quantities while the clinical trials were going on. So as soon as the clinical trials were finished, large volumes of vaccine would be able to be shipped out as soon as the FDA made it under the EUA, or emergency use authorization status. So I also wanted to let you know that all the COVID testing that we're doing, those are still not licensed by the FDA either. Those COVID-19 tests that we're using are also still under emergency use authorization, and we've been using them because we had to try and get ahead of this pandemic. Next slide. So this slide is a busy slide, but the point of this slide schematically is to show you the difference between the traditional paradigm of making a vaccine. and that the vaccine companies do obviously take a risk of doing this, making large scale manufacturing of the vaccine, even while they're going through clinical trials. But the point of all that, as you can see at the bottom, is while clinical trials are going on, large scale manufacturing has been going on that we have all been paying for. So that is why we were able to have so much vaccine available in such a short period of time. And this is likely the way that vaccines are going to be made from now on. Next slide. So I think it is a good idea when considering about whether to get this vaccine or not, is to consider not harming yourself because of the sins of others and things that have been done in the past. That is not to say that you're ignoring it, but not getting this vaccine is going to be a missed opportunity. There are so many things that has happened to us as a community that in the past, in the present, that we still obviously have to deal with, but the COVID-19 vaccine process is not one of them. Next slide. So my advice to everyone when you're thinking about getting the COVID-19 vaccine is to talk to your physician, look at the science, and make the decision based on science, not emotion. And the references at the bottom of the slide are from the National Medical Association website. The National Medical Association is the Association of Black Physicians that was started in 1895. And they got together a task force on vaccines and therapeutics and actually independently looked at all the research. And you can go on the NMA website where they discuss in detail their evaluation and their recommendation that we get this vaccine. So to end the presentation, I will say that I got the Moderna vaccine on Saturday. I had some tiredness, some soreness in my left arm. And other than that, I'm fine. And I'm looking forward to getting my second injection on February 6th. Thank you.
Thank you so much, Dr. Barnes and Dr. Co. This is a very informative presentation, really helped to clarify, I think, some of the questions that we would have been asking otherwise. So thank you so much for being proactive and setting the record straight on some of this information. I'd like to direct the next few questions. We have quite a few questions. So I'd like to direct the next few perhaps to Dr. Reed, Dr. Dufresne, and also Ms. Hunter. Firstly, can you tell us about what you are seeing in your roles with regards to patients and the experience around having COVID? You know, our presenters just told us about the seriousness of this. This is nothing to play around with or to try to wait it out. Are we doing any better now than we were doing in the spring?
All right, so this is me, Dr. Reed. What I'm seeing is just like what Dr. Bonita Co and Dr. Barnes just said, we are seeing increased numbers, whole families that are being affected. Today, I was talking to a patient and all 5 people in her household are sick with COVID. That is the reality. And I guess the other reality that I want to reiterate, just like how we just heard in that really good presentation, is that we're not talking about the long-term effects. I have patients who have constant headaches, cannot return back to work, dizziness, loss of eyesight intermittently, hearing loss. I myself and Dr. Launette, we run together. We've done marathons together. I can barely run 2 miles. Now I have asthma officially because of the inflammation from COVID. So we're seeing that in other patients besides myself, neurological changes, blindness, I said already, but then also blurred vision and eyes not being able to focus. So I like to say to people, I too did receive the Moderna vaccine New Year's Eve. I should be receiving the second one in another week or two. But as going through COVID, I had every single symptom you can think of except loss of taste and smell. And I'm talking about from fever to vomiting to diarrhea to headaches to chills to muscle pain. And to have to go through that is far worse than me sitting there taking 15, 20 minutes out of my time to have a vaccine that will give me a longer period of immunity. Because keep in mind, this is new. We're not sure how long we're going to have the immunity for, but the immunity from the vaccine is going to be longer than the immunity from me having COVID. And the only effects that I had was just my arm felt really sore. I felt like I'd been doing an intense upper body workout. I felt a little tired, but that could have just been life, being a doctor, seeing patients. But the real thing was the muscle pain. And I did take some Motrin. And by day 3, 4, I was fine.
Thank you for clarifying that question, because you answered perhaps a bit of the second question, which perhaps I'll pose to Dr. Dufresne to elaborate on. And that is this question about for those who have had COVID already, right, and have antibodies. The question is, do I still need to get this vaccine? Am I not protected? And also, if you can elaborate on that and tell us, the borough president was telling us about the disparity, the racial disparity in the prevalence of COVID in the Black community. So can you tell us a bit about why that's so and what we need to be doing differently?
Yeah, absolutely. So I'll start off by saying that I'm, I guess, the freshest to the group here in that I got vaccinated about an hour and a half ago. I got my first vaccine an hour and a half ago. If the Queensborough president is still here, I want him to let him know that they fixed the second appointment thing, because they booked me for my second appointment right then and there. It was smooth, it was easy. I was in and out in pretty much 35 minutes. To answer your question, I think that part of the issue is in the same way that we are more predisposed for various reasons to a number of medical conditions and clinical indicators, like chronic, diabetes, hypertension, heart disease, and so on. Those are the same reasons why, or at least some of the same reasons why we are more prone to getting sick. And then when folks of color do get sick, they're more often will get more severely ill. So I think it makes it all the more important to be protected up front. I think what Dr. Reed said is spot on, in the sense that for folks who've had the illness before, the data or the research seems to suggest that there is some protection, probably that goes somewhere between 3 to 8 months, depending on the individual. The vaccines, and actually Moderna just came out this week and said that their data suggests that there's at least 12 months of protection. So again, with some preliminary information, I think it seems to suggest that there's more protection than the protection from having gotten the illness. And although we're not hearing a ton of folks who've gotten sick twice, it's definitely happened. And we've heard about it even in athletes and actors and so on. To answer, I saw that somebody chatted in really quickly about the mutations. I'll comment and say that the Pfizer vaccine so far, it looks like there's some information there that suggests that it does seem to be effective, especially against the British variant. There's a South African variant, and a few others where the information is not quite there. But the suggestion is that the targets of the vaccine should be able to be effective against the other variants as well.
Thank you for answering that question. Of course, we were going to get to those questions in the chat, and I know that was one that many people have been asking about the efficacy of the vaccine, considering these variants that we're now seeing. So thank you so much. Ms. Hunter, can you tell us a bit with your podcast, Not Just a Nurse, can you tell us a bit about what your experience has been with COVID-19 in our communities and nursing as well?
Sure. So I work in the hospital on a tele floor. So we see a lot of patients basically when they come in, they're having breathing trouble and they're also having heart problems. So we get a lot of them in our unit, and our unit is a high turnover unit. So what we're seeing is that a lot of patients are coming with blood clots in the lungs, PEs. And with that, accompanied with the COVID, they call it COVID pneumonia, right? So what's happening is that these patients are not getting that negative COVID result as quickly as, you know, they may think that they'll get them back. 14 days, they're expecting a negative result. So when we try to transition them to another level of care, that's not happening quick enough. So we have the patients, they're coming in sicker and we can't discharge them anywhere. So the hospitals are getting crowded and we're seeing just an excess amount of patients in the hospital. Yes, we kind of have a better way of dealing with COVID. So we don't see as many deaths, but we definitely see more patients coming in and not actually being able to transition home because of these communities in Queens, like the borough president did say, that these communities in Queens are so clustered. So they don't have the ability to quarantine at home. So the families are afraid to bring them back home. So we have to keep them or transfer them to another one of our sister hospitals. And so they're running out of room. So the problem is with not getting vaccinated, and people say, oh, we'll wait to see. Well, the concern is they may not be enough vaccination for you to wait it out. So we're definitely in quite a pickle because if we don't get vaccinated, we're not going to be able to stop this pandemic and people are just going to keep dying. Over 4,000 people died in one day. You know, how many more people have to die before people really understand what is your plan? It's either you're going to take the vaccine or you're going to wait for COVID. Just this week, I share a personal story. My daughter and I have 3 children that came in from Georgia for the holidays on January 2nd. Got them tested on January 4th. All of the rapid tests came back negative. I was fine. Then I get a call, the PCR of one of my children was positive. So the test, like Dr. Previously said, the tests are not that approved either, but we're using them. One test came back negative. Now she's positive and I have to be at home. And there's nothing like having a child sick. It doesn't matter. You know, when your kid is sick, you're up. So, you know, this affects families. It's so quick. I can't understand because the other 2 kids are negative.
Right.
But she's not. So you don't know. So we can't take these chances because it's rapid. It's rapidly spreading and she has no symptoms. Yes. So now she's wondering why she has to be locked up. But
yeah, the asymptomatic spread is something we have to be very concerned about.
Something very serious.
Yes, and thank you for pointing out the realities that are going on in the hospitals, which have to do with bed capacity and occupancy, right? And so we run the risk, the longer we wait, we run the risk that there won't be beds available for us when we choose, to seek care. So that's another huge risk in not acting with regard to the vaccine. I'd like to go to New York City Councilwoman Adrienne Adams. Ms. Adams, do you have a question or comment to share with us tonight?
Thank you so much, Dr. Wilford. It's great to see you. And I just have to say off the top, this is one of the better forums that I've been in with regard to COVID-19 and the vaccine overall. So kudos to everyone, especially all of my sorors and the links for putting this together tonight. I'm so proud of you all for doing this. The information is absolutely fantastic. I just wanted to chime in. I wasn't a panelist, but, and I was texting Donovan the whole time, BP, I'm getting used to this BP business, BP Richards. I was texting him the time that he was speaking because he was sharing a lot of information that was very valuable as far as our community is concerned. So I just wanted to just chime in and maybe just turn the conversation upside down and then we can come back right side up again. But for those that don't know, I represent District 28 and that right now encompasses Rochdale Village, Jamaica, South Ozone Park and Richmond Hill. Richmond Hill right now is spiked over 16%, the highest incidence of positive COVID right now pretty much in the city of New York. So Donovan did reference a hearing that we had yesterday, a joint hearing in the city council, in which my colleagues chaired that hearing. And we had Dr. Choksky. Now, I'm no stranger to him, just to let you know. I did question him and I asked him, we have seen this pandemic across Southeast Queens, across our communities of color since February, March, April, and we have seen the spike. We have been the hardest hit in the entire city of New York. And my fear is that we are, with the lack of access to this vaccine, we are destined to repeat the same number of deaths in our communities of color, the way that we have with the onset of COVID-19 in our communities. And my question to him was, what do we do about the access right now? What do I tell my constituents who are asking, what is Councilmember Adrienne Adams doing to get us vaccinated? Like Donovan, I will stand in line and be the next one tomorrow to get this vaccine. I think it's that important. And the fact that a Black woman was responsible for helping to make this happen, I'm even more excited about being vaccinated. So I want to go on record in saying that please get vaccinated when you can. But the access is what concerns me. And Dr. Choksky, bless his heart, agreed that there really is no answer as far as the prioritization of vaccination and the way that the city and state decided to do this vaccine prioritization. I just wanted to throw that out there because I think there is a lot of fantastic conversation right now about the vaccination, how important it is, how vital it is for us, communities of color, to get vaccinated as soon as possible. But please know that our communities are not the communities that are prioritized right now. And for me, that is the fight that I am fighting, to get our communities that are most affected by COVID-19, Southeast Queens, in my neighboring district, Jackson Heights, where Elmhurst Hospital is located. My father passed away of effects of COVID in May after being hospitalized for 2 months. He lived in Jackson Heights. This is very personal for me. So I just wanted to make sure that I was a part of this very important discussion and just letting everyone know that this is a fight that we have to look at on both sides of the equation. We must be vaccinated as a people of color. We cannot continue to go out like this. And we must make sure that the access to our communities most hit hardest by COVID-19 have equitable access to this vaccine. Not like we've seen before. We've seen the Javits Center opened up to people that don't look like us. Prepared, there was nothing there. Central Park about to be opened up for people that don't look like us. So my fight with my friend Mayor de Blasio continues, and my friend Governor Cuomo continues. They hear me, but they're not listening. So I just wanted to go on record and letting everybody know. And just P.S. August Martin High School, for those of you that are in my District 28, that will also be a vaccine center beginning next week, like Hillcrest High School. Donovan mentioned Hillcrest, that was opened the beginning of this week. Guess who was online? Not just my constituent from Rochdale, who was in her 90s, but the very, very mass majority. She was not in the majority on that line of hundreds. The majority on that line of hundreds at Hillcrest High School did not look like you and I. That is what we have to deal with. That is why I need all of you to go online. Those of you who are eligible right now, as far as the city and state are concerned, make your appointments for the vaccine at August Martin High School in our district. Next week, get on the line. I've heard some horror stories about how long it is, but you have to register. You have to make that appointment online in order to get that vaccine. Let's do this, everyone. Let's save ourselves. Let's save our loved ones. Thank you for giving me some time tonight, Dr. Wilford. Bless your heart. Thank you so much, sorors and links and doctors.
Before Dr. Nanette, I just want to interrupt. So Councilwoman Adams, I would just like to say, as a doctor who is in your area in a private practice, and there's a reason why I wanted to go into that area to serve people who look like me, we haven't been able to get the vaccines yet into my practice. So whatever you can do to help my patients who are looking like me, I would love to be in contact with you so we can get that going, because even my own parents, the only reason why they're going to be able to get their vaccine is because one of their local legislators had to make sure that they were able to walk across the street from where they live to get their vaccine, because the line wasn't looking like anything that was black and brown. And I really don't want my community to suffer any more than what we've already suffered so far. So I really want to connect with you.
Thank you, Dr. Reed. Let's be in touch. Like I said, I lost my dad. So for me, this is very, very, very personal. So thank you. Let's keep in touch. Thank you.
Thank you so much, Councilwoman Adams. I mean, your presentation was just so spot on, powerful, relevant. And thank you for the work that you do for our community, for people who look like us, and for really sharing the facts, the information that we need to know to make informed decisions. Thank you for everything you do every day and for being with us tonight. We're really fortunate to have you with us tonight. Thank you. I do want to turn to Dr. McGlashan to give the teens, our youth who are on the presentation with us tonight, an opportunity to ask their questions. Dr. Alex?
Oh, thank you so much, Dr. Wolford. Yes, Dr. Wolford, can you hear me?
Yes.
All righty, so I'm going to call on teen Brianna Robinson to ask her question. Brianna, if you can unmute and also turn your camera on, that would be great. Go ahead.
Oh, hi. So my question is, do you think kids my age will eventually be able to get the vaccination? And if so, does that mean that we will be able to return to school in the fall as well?
Thank you, Brianna.
Any of our panelists can take that question. Thank you.
Brianna, thank you very much for the question. I have two sons. They are 16 years old. And the hope is, yes, pretty soon that they will be able to. New York now has, especially in the city, we are now looking at ages 16 to 65 who have what we call decreased immune response. So they're immunocompromised. So anyone who is 16 to 65 is going to be able in New York to receive the vaccine. And I'm pretty sure everyone else is going to be right behind. The only problem that we have, it was mentioned earlier by our borough president, is that we have over 7 million people in New York who are eligible. But guess what? We're only getting over 300,000 vaccines per week from the federal government. So hopefully with the change of administration, that'll happen. And that way, Brianna, you and your friends, yes, you will be back in school, but of course, everyone is going to be still wearing their masks, even if we've had our vaccines, okay?
Thank you so much. Thank you, Brianna. Next, I'll ask Isema Castle to pose her question. Isema, if you can unmute and turn on your camera. Thank you.
So as you all have discussed, there is a clear distrust with our community and the vaccine. The question I have for this panel experts is if your non-POC health professional counterparts that are advocating for African Americans to take this vaccine are confronting the racist past in the medical field.
Thank you. Good question. Any of our panelists who can answer that would be great. So I believe the question is whether, if I'm not mistaken, whether non-people of color in the medical field are getting training about the history of African Americans and other communities of color and the distrust in medicine. Is that correct, Isema? Okay.
Well,
maybe Dr. Dufresne?
Yeah, I can answer some of the questions. This is Esteem. I can answer some of the questions. So I know at the hospital where I work, there's been a lot of, we have an Institute for Justice, which addresses issues about racial disparities, ethnical, cultural disparities related to different healthcare topics. And now with the COVID vaccine being one of those, that is something that we're doing not only with the community, but you'll find it hard to believe that even within the healthcare community as well, we have to do a lot of talking about, we understand about Tuskegee and things like that, but this vaccine is still very important for us. Even at being on the front lines and people have actually taken care of COVID patients and seeing people die from COVID, there's still some healthcare professionals themselves who do not want to take the vaccine. So yes, there is a lot of education for non-people of color and for people of color centered around disparities, which will have some people not wanting to take the vaccine.
Thank you so much, Dr. Barnes and Isima. Next, I'm going to go to Wesley Ramsey. Wesley, if you could unmute and turn on your camera. Thank you.
Okay, so knowing that there are a lot of people that don't trust the vaccine, especially in African American communities, and that are really content with not taking it, do you believe that the government will use a person's field of work or even being on a campus at a school as a reason why it's mandatory to take?
Thank you, Wesley. Good question.
I'm happy to answer that. I missed the second part of the question. I'm sorry.
Okay, I said, do you believe that the government will use a person's field of work or even being on like a campus for school as to a reason why it's mandatory to take?
Understood. That's a great question, Wesley. I think that of what we've seen in the past, and for example, this is true for the flu vaccine in a number of fields and certain states where that is a requirement in order to work, and that's largely related to being able to keep the folks that you are working with or working for safe. I think eventually there probably will come to be some legislation around needing a vaccine to perform certain activities. I think more importantly, though, what we should be trying to do is encourage folks to get vaccines because it's good for them and good for their families. And so ideally through forums like this, we're able to help sort of spread the word and help reinforce why taking care of ourselves and our own communities is beneficial to us. But again, to answer your question, I think that there are going to be certain sectors that likely will require that, including travel and like you said, schools and certain lines of occupation.
Okay, thank you so much, Dr. Dufresne, and thank you, Wesley. All righty, Jabari Duncan, your question, please, if you can unmute and turn on your camera.
Thank you. My question is, if herd immunity is achieved when 80% of people are vaccinated, what can civic organizations do to possibly assist in the funding vaccines for developing countries and economies?
Okay, Jabari, can you repeat that question?
Yes. If herd immunity is achieved when 80% of people are vaccinated, what can civic organizations do to possibly assist in funding vaccines for developing countries and economies?
Oh, thank you so much. Okay. Any thoughts on that? That's you're thinking ahead, assuming that we already are okay here in the US. What can we do to fund other countries who may not be as wealthy as we are? Okay. Any panelists would like to take that question?
So I can try. That is a serious question that you asked, but I have spoken to other people, other nurses. I spoke to one nurse in the Philippines and I spoke to another nurse in Israel. And both those nurses are saying that the vaccine's already available and they're already vaccinating. So I think herd immunity is probably going to be attained countrywide, probably around the same time. But I'm sure for the underdeveloped countries that can't afford it, I think everyone will chip in at this point because travel happens, and that's where a lot of this vaccine, the COVID-19 actual disease is being spread through travel. That's the biggest one. So I think that's going to be everyone's concern.
Thank you.
Thank you, Ms. Hunter. And I believe you have done some work in the Caribbean, supporting the medical field in Jamaica, I
Yes.
believe, yes?
Yes, I've done some cross the border work, and I went over there. So, you know, that in Jamaica, there is definitely, they're handling this COVID pretty good, because is really, the government really are very active in embracing and making sure that people are wearing their masks, their curfews. So when I speak to my counterparts in Jamaica, they're definitely serious about controlling the spread. You can't even get into the country without being quarantined and tracked heavily for 2-3 weeks. So a lot of people just don't even go, because in 2 weeks it's time to come back home. So they're containing it pretty good. Our numbers are actually bigger than theirs.
Thank you so much for that. Thank you to the teens for your participation. And with that, turn it back to Dr. Wolford.
Thank you so much. Yes, it's wonderful to hear the voices of our youth. We appreciate your contributions to this very important conversation. This affects you very much, as you have long futures, long bright futures ahead of you. We are coming close to our wrap-up time. I want to entertain one more question. There was a question in the chat about if someone can discuss the relationship of allergies to vaccination, and if there's anything that folks with varying allergies should be concerned about. Can any of our panelists speak to that?
I can answer that briefly. I'll start off just by saying that, of course, you should always discuss this with your primary doctor first. And as it turns out, they do a really good job at the intake prior to your vaccine of diving in a little bit to better understand your allergies. That said, the Society of Allergists have really been forthcoming in trying to push the fact that the majority of folks, regardless of allergies, can safely take the vaccine. In large part because there are not a lot of components in the vaccine that are typical allergens, like eggs or seafood or fish or things like that. So because they're quite unique, the components of the vaccine, it's very rare for there to be overlap in terms of allergies. All of that said, of course, it's always important to discuss that with your primary doctor.
Perfect, thank you. I do want to encourage everyone to take a look in the chat. There's wonderful additional information in the chat, plenty of links and other resources that have been shared while we've been dialoguing. So at this time, and I also, as your moderator tonight, would very much like to thank our panelists. I think, as you can see in the chat, the information you have shared tonight is tremendously valuable, very important, and we appreciate the time and effort that you have taken to put together that wonderful presentation and to share your other information about experiences and facts with us. I'd like to thank Councilwoman Adams for being with us tonight and for all that she does on our behalf, the Queensborough President for being with us. It's really an honor to have both of you representing our voices where we cannot. So, and I'd like to thank our hosts, of course, my beloved Epsilon Pi Omega chapter of Alpha Kappa Alpha Sorority Incorporated, our co-partners, the Links, the Greater Links of Queens, as well as Jack and Jill Queens chapter and the fabulous teens from Jack and Jill. So at this time, I'd like to hand it back over to Kim Adams to introduce some of the closing remarks and the survey.
Thank you very much, Dr. Wolford. Everyone, to all of our panel this evening, thank you, thank you, thank you. You really spoke to the heart of our community this evening. I think you said the things that we needed to hear, and we really are desperate to hear. We need to hear these messages and inspiration to move. So thank you for being a part of our program this evening. And before we go, I do want to put up a survey. We would like to know how you were impressed by this presentation this evening. And it couldn't be easier. You can answer this poll right here before you right now. These are the questions. I learned at least one new fact about the COVID vaccine from this presentation. Please respond. The information was presented in a clear and comprehensive manner. The webinar met or exceeded my expectations. The time allotted was appropriate for the subject matter. I'm certain we could go on, but we have to respect the time of everyone, of all of our experts and all of you who are here this evening. And of course, would you be interested in similar health-related webinars in the future? Everyone, this was a labor of love to gather all of the participants, and everyone willingly just volunteered their time and recognized the need and met the moment. So to everyone, again, we thank everyone for attending tonight. We thank you for your active listening. We thank you for actively putting information, questions in the chat and engaging our specialists. And we appreciate you, and we want our community, wherever our community is, we want our Black and Brown people to survive. So please heed the messages that you've heard tonight, and let's do this.
May I ask, before we close, there's a question, there have been several questions in the chat about how attendees can access this presentation in the future.
So thank you for asking that question. We are actually, Epsilon Pi Omega has been recording this presentation, and we will make sure that it is available on our website. It will be posted there. I believe we will make sure that we have a presence also on social media. So wherever we can post, please look for our website. Can someone put our website in the chat? Our social media handles, as well as our partners, the greater Queens chapter of the Links. Did I say that correctly? Yes.
Yes, you did. Thank you.
So we will be certain that it is also made available so that you can also have that, it will be on your website as well. We just want to get the word out. This is what this has all been all about this evening. It's all about you. It's all about you. So you've been empowered. It's time for you to do what you have to do now. So I'm Kim Adams, Vice President for Epsilon Pi Omega chapter of Alpha Kappa Alpha Sorority Incorporated. We thank you for being here tonight, and be well, everyone. Wonderful. I see many people participated in the survey. Great. Thank you, everyone.
Thank you.